Hi guys, welcome back to our channel. Today in this video, this is what you need to know about breaking a fever. If you or someone you're caring for has a fever, follow these steps to break the fever. 1. Take your temperature and assess the symptom. If your temperature runs 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, you have a fever. 2. Stay in bed and rest. 3. Keep hydrated. Drinking hot water, iced tea, or very diluted juice to replenish fluids lost through sweating. But if keeping liquids down is difficult, suck on eye chips. 4. Take over-the-counter medications like acetaminophen and ibuprofen to reduce fever. Note the proper doses and don't then use alongside other fever-reducing medication. You shouldn't give aspirin to your baby or child without consulting your doctor. Infants under 6 months of age shouldn't be given ibuprofen. Stay cool. Remove extra layers of clothing and blankets unless you have the chills. 6. Take tablets, baths, or using cold compresses to make you more comfortable. Cold bath, ice cube baths, or alcohol baths or rugs can be dangerous and should be avoided. 7. But no matter what the number on the thermometer reads, if you have any concerns, consult your doctor. Running a fever is the body's response to fighting infections caused by viruses or bacteria. Fevers can also result from sunburn or from getting immunizations. Anyone can get a fever, regardless of age. People who have compromised immune systems may tend to have fevers more often than others do. How to assess the situation? A healthy adult with a slight fever may feel like they've been hit with a Mack truck, but a baby with a high fever may sometimes feel pretty uncomfortable. The reverse of both scenarios can also occur. Fevers aren't one size fits all, and neither are their symptoms. Your overall comfort level and symptoms can help you decide how to treat a fever. If you have a fever, you may experience the following symptoms: feeling weak or lightheaded, loss of appetite, headache, muscle aches, sweating, chills, nausea, vomiting, rash. If a rash accompanies your fever, you should consult with your doctor. It's important that your doctor determines the root cause of the rash. Other symptoms such as nausea or vomiting may resolve more quickly with medical attention. If your fever is over 103 Fahrenheit, 39.4 degrees Celsius, you should seek intermediate medical attention. This is especially true if you're experiencing confusion, hallucinations, or convulsions. Temperature taking 101. Most people have a baseline temperature of 89.6 degrees Fahrenheit, 37 degrees Celsius. Although some people have a baseline that's slightly higher or lower, daily temperature fluctuations are so normal. Different types of thermometers can yield different results. You are considered to be running a fever if an oral, rectal, ear, temporal, artery thermometer registers 100.4 degrees Fahrenheit, 38 degrees Celsius or higher. If you use an oscillatory thermometer, the temperature reading will be around 1 degrees Fahrenheit or 1 degree Celsius lower. Also, anything over 99.4 degrees Fahrenheit, 37 degrees Celsius would constitute a fever. Many pediatricians recommend using rectal thermometers for infants and babies. Discuss with your doctor which type of thermometer to use. You should also be sure to let them know what kind of thermometer you use to record your child's temperature. Get answers from a doctor in minutes anytime. Pediatricians and other specialists available 24/7. When to see a doctor. How and when you should treat a fever is generally determined by your age. If left untreated, fever can lead to serious complications in young children, older adults, and people with compromised immune systems, infants and toddlers. Infants up to 3 months old should be seen by a doctor if they have a fever of 100.4 degrees Fahrenheit, 38 degrees Celsius, or above. They should still see a doctor even if there are no other symptoms present. Babies 3 to 6 months old may not require treatment for fevers up to 102 degrees Fahrenheit, 38.9 degrees Celsius. If your baby has other symptoms or their fever goes above 102 degrees Fahrenheit, 38.9 degrees Celsius, you should call your doctor. Children then ages 6 months to 2 years old who have temperatures at above 102 degrees Fahrenheit, 38.9 degrees Celsius, may take an OTC medications under a doctor's supervision. Let the doctor know if the fever persists for more than a day, worsens, or doesn't come down with medication. Young children and adolescents. Children aged 2 to 17 years old generally don't need medication to reduce fevers under 102 degrees Fahrenheit, 38.9 degrees Celsius. They may benefit from medication if they experiencing symptoms such as irritability or muscle aches. If the fevers go above 102 degrees Fahrenheit, medication may be used to bring it down. If your child is very uncomfortable or if the fever persists for more than 3 days, you should consult with your doctor. Adults 18 and over typically don't need medication for fever under 102 degrees Fahrenheit. Fevers above that number may be reduced by medication. If your fever goes above 103 degrees Fahrenheit or doesn't respond to treatment, a call to the doctor is warranted. Adults with a fever and other symptoms such as stiff neck, severe pain anywhere in the body, or shortness of breath should seek immediately medical attention. Fever in adults over age 65 doesn't automatically require special treatment, though you should be on the lookout for symptoms such as shortness of breath or confusion. If you are experiencing these symptoms, you should seek immediately medical support. You should also consult with the doctor if your fever goes above 102 degrees Fahrenheit or doesn't come down within 2 days. You can try OTC medications, but you should be sure if they won't conflict with any other medications you're taking. Other guidelines. If you have a compromised immune system, you should seek a doctor's care. A compromised immune system is common in people that have HIV, cancer, or autoimmune diseases. Fever is often a sign of infection. Sometimes these infections are fast-moving or hard to treat. So if you have a compromised immune system, getting immediate medical support for fever is important. And that's the end of the video. Thank you for watching. If you like our video, don't forget to click like, subscribe, and share it to your friends.